Hello, this is Barbara Brandt, Director of the National Center for Interprofessional Practice and Education. Today we're joined by the Jefferson Center for Interprofessional Education team. And they, as Sean said, they are presenting a presentation, Kapow, Changing on a Dime, Successes and Challenges with Virtual Home Visits in the Jefferson Health Mentor Program. So on behalf of my colleague, Gail Jensen, who is at Creighton University and is the current chair of the American Interprofessional Health Collaboration, I welcome you to this webinar. We started these series of webinars several weeks ago when the numbers of requests coming into the National Center were increasing during the pandemic as we started to realize the full extent of the COVID pandemic. So we've hosted web-based discussions, webinars, and forums to foster learning and conversation. This webinar will be recorded and archived, so share widely with your colleagues. And this is the URL where it can be accessed. That will also be sent out to you after the webinar. So with that, I turn it over to my colleagues at Jefferson, and they will begin the webinar.
Good afternoon, everybody. My name's Elena Umland. I'm one of the co-directors at the Jefferson Center for Interprofessional Practice and Education, and today, along with our two faculty members who really do oversee our Jefferson Health Mentor Program, Nathra Enkham and Ann Mitchell, will be presenting to you what we had to do very quickly. I suspect the title, Kapow, Changing on a Dime, is something that could apply to anyone, anywhere, trying to do IPE in the weeks following the shutdown, if you will, or the changing of the way we are used to doing things. So we're happy to be able to share this with you. And I'd also like to acknowledge for this program, which you'll see very shortly, if you're not aware, it's a very large program at our university and involves many students, and it is longitudinal over a year and a half. And we certainly could not do it without our program director, Sarah Dallas, and our program assistant, Aiken Ukanen, who are extremely key in helping us to move forward with this program. So with that, just to give you a little bit about our presentation overview and what we plan to do. Next slide, Sean. Thank you. Just a brief overview of the Health Mentors Program and then the time leading up to the need to make changes very quickly at Jefferson. I'm going to cover that part, and then Anne will discuss the process and what we needed to do to mobilize this very quickly. And as of last Monday, April the 13th, we did wrap up this semester's module of the Health Mentors Program. So we do have some results and some outcomes that Nathra will be sharing with you. And then keeping in mind that I think, obviously not just for Jefferson, but nationally, I don't think when I use the term return loosely to classes in the fall, things will be very different. So some things that we need to think about in planning for the future as we continue with this program and other interprofessional programs. So we'll be asking for some of your brainstorming in the last section of today's webinar. So a little bit about the background and leading up to our Kapow for the Health Mentors Program. Next slide, Sean. So the Health Mentors Program is a longitudinal interprofessional education curriculum, and the teams are teams of 5 to 6 students, and they are paired with a health mentor, and I'll describe the health mentor in a little bit. And the teams do complete 3 modules and related assignments over 1.5 years. So from the time they walk in the door at Jefferson until halfway through their 2nd year. Where we happened to fall in the midst of COVID was Module 2, so slap dab in the middle of everything. This program is required, and it is part of the curriculum of the 9 disciplines who participate in the Health Mentors Program. Next slide, Sean. So to give you an idea of what we hope to do over a year and a half of this program for our students, The goals of the program is that they will observe how a person's environment, both social and physical, interacts with their health and well-being. And I would ask you to focus particularly on that outcome goal, because certainly that is one that was greatly impacted. In that Module 2 is a home visit for our Health Mentors program. And then the other 3 goals of the program: understanding and valuing patient-centered care, just meeting students from other professions, and valuing and respecting the varied and changing roles of those other disciplines. Goals 2 through 4 in particular reflect the IPEC core competencies as they are rolled out over a year and a half in those 3 modules. Next slide, Sean. So who are our health mentors? And this will give you, herein lies some of the challenge with COVID. They are 250 volunteer adults, and they all have one or more chronic health conditions or impairments. They do participate, as I mentioned, as a full member of the team, and they serve as a mentor, as a teacher. The students are informed, educated from the beginning that that the mentor is not their patient. The mentor is really intended to be their teacher in helping them learn what it's like to be a patient with a chronic health condition, maneuvering the healthcare system in the United States. And as noted earlier, the students do meet with the same health mentor over a year and a half. As far as thinking about COVID and our highest risk populations, they tend to be the elderly. Many of our mentors fall into that category. Obviously, one or more chronic health conditions. So the majority of our health mentors really are in that high risk group for COVID-19, which is something to keep in mind, not just for as we completed this module, but as we move forward to Module 3 in the fall. Next slide, Sean. So as far as who our Health Mentors Program students are, just to give you an idea of the breadth. So in Module 2, we have over 700 students across the 9 disciplines who participate. The largest on our campus, the Gorilla, is the medical school, over 200, close to 250 students, seconded by nursing. And then the other programs who participate: couples and family therapy, genetic counseling, medical and laboratory sciences, occupational therapy, physician assistant, pharmacy, and physical therapy. So as we moved into this issue, this was one of the things that we needed to keep in mind. We have over 700 students. We have over 140 student teams. Next slide, please. So to give you a little bit of a flavor for the curriculum and what happens, I mentioned that where we fell for spring and in the midst of COVID was smack dab Module 2. The other piece that was affected during year 1, the students have to complete a team observation. We have many activities over the lunchtime hour where we bring high functioning teams in for a grand rounds type of experience, and the students get to learn from them. Obviously, our semester was cut very short, so we needed to think of, one was a way to deliver the year 1 team observation so that the students would be able to complete year 1. And the other piece was for Module 2. At the time when we went online, which was as of March 16th, we still had 44 teams who had not met with their mentor for the semester. And then the other piece with the curriculum. So again, moving forward, thinking about Module 3, or some things we need to think about and can come back to at the end. Professionalism, teamwork, and social determinants of health are underpinnings of the entire curriculum. And again, with Module 2 being a home visit, the students being able to really see the social determinants of health has always been a very valuable piece, educational piece for Module 2. Next slide, please. So leading up to the Kapow. So in late February, the academic pillar instructed the university to begin contingency planning for the April to June timeframe. What I will note, and I don't know if other centers may have had similar experiences, is that a lot of the communications regarding things and how they would need to change and what we were being asked to do filtered down through the colleges and the deans. In our organizational structure at Jefferson, For example, the Center for Interprofessional Practice and Education, the Simulation Center, the library, do not necessarily fall directly within the academic pillar. So some of us were finding early on that it was only by virtue of our interaction and interfacing with the other colleges that we became aware of this and our need to move forward. So that's been kind of a lesson learned, if you will, for the university, and I think for other centers to think about as well. So that was an aha for us and an opportunity for us as a center to step forward and say, we serve an awful lot of the students on this campus too, so we need to be kept in the loop as well. March 11th was the official notification to the academic leadership that we would be moving completely online beginning March 16th. The oversight of this process has been seen by the Senior Associate Provost for the Academic Enterprise. And again, noting our notification of contingency planning and the impact on JSite moving forward has been, ever since the beginning, and being left out a little bit has put it higher on my radar as far as making sure that JSite is also included in all of this planning. As of 3/16, and as I alluded to before, incomplete work for the Health Mentor Module 2 certainly existed. We weren't even halfway through the semester for several of the disciplines within this program. So we had unfinished team meetings, particularly those extremely valuable home visits with the health mentors. We were missing a number of year one team observations that the individual students complete. And the other piece was, at the end of every module, at the beginning of every module, we have an orientation. So we did have Module 2 orientation in January. At the end of every module, we have small group debriefing sessions where we tend to bring anywhere from 5 to 9 groups together in a room, facilitated by one or more faculty members, to really talk about how the module went, what the students learned. We focus on teamwork, we focus on patient-centered care, and the students get to really learn about the other groups and their experiences and the experiences they had with their mentors, because the mentors are very diverse. And that was scheduled for April 13th, which obviously required quite a bit of planning to figure out, how are we going to do this? How are we going to do small group debriefing sessions April 13th for 140 teams, of which at the time, 40 of them had not even completed their home visits with their health mentors. So with that, I am going to pass the torch to my colleague, Ann Mitchell, who's going to describe the process and what we did to prepare for this.
Hi. So like Elena said, Module 2, 140 teams, April 13th. So we did have a few weeks. So our first thought was about facilitator preparation. So we were fortunate that we did have some experience in the sense that we had precedence. On our campus, there's another advanced interprofessional group called the Hotspotting Teams. They had March 21st, similar type presentation where they were getting their teams together. They had 15 teams, we had 140 teams. Their teams also meet in a slightly different format. It's a longer format, so the movement between teams doesn't have to be quite so crisp. So our next thought was like, okay, we saw how they rolled it out. We all viewed and were participants in that, so we could see how that worked on March 21st. And then we thought, well, feasibility. What is the feasibility to do this? 140 teams, typically it's over a 2-hour period. They're divided into 2 groups. So we consulted our academic commons resource person, or we have a liaison in the library, and we wanted to discuss. We had viewed it in Blackboard Collaborate. What were other options? Could we do it on Zoom? Were there other platforms that we thought could work? So we settled on the Blackboard Collaborate in Canvas. It had worked for the other team. Our liaison felt that that would be a good fit for what we wanted to do also, because it was very similar type format. Again, a little crisper because each team only had about 7 to 8 minutes to present their presentations. But in terms of the number of teams in each room, if you will, it was very similar. So we thought, okay, well, that's our plan, but let's make sure it's okay with those that are going to facilitate for us. So we wanted to test on the expertise of our facilitators. So we polled them, what's your comfort level? Have you used Blackboard Collaborate in Canvas? Would you feel comfortable? Would you feel comfortable as long as we give you some training? So we got the results back. Everybody was on board and said they would be okay with that. The other thing that we had done in the past, which we were going to move forward, was our format. So there is group discussion, but prior to, within that, the key piece of our Module 2 presentations. So our presentations, each group has a 5 PowerPoint slide presentation that they do, each team. So we have a very simple rubric. So that would make it easy for the facilitator to be able to manage the room and know what they were required in terms of whether a student team had fulfilled all the requirements on the rubric. The other thing we had to think about realistically for our our April 13th presentation was reinforcements. So we had facilitators, but we had to have some backups, because at our institution, some of our facilitators are physicians and nurses in the clinical setting. So we needed to make sure that we had some backups, because some of those who had agreed to be facilitators were actually working in the hospital. So we knew that anything could really change on a dime in that situation. So thinking then about our student preparation, on our next slide, we'll talk about our students. So the baseline, so we wanted to know how many teams had completed their Health Mentor home visit. So we learned that 94 out of the 138 teams completed their visit prior to, as we put it, the Kapow on March 11th, when everything turned around. So then we thought, well, what's their feasibility? So could the teams contact their health mentor to determine if the visit could be conducted through technology? So whether that was through some type of platform, like a meeting, a virtual meeting like Zoom, or in some cases, if that wasn't possible, could they at least have the team liaison? Each team has one student who is designated as a liaison, that the team could, the liaison was willing to talk to the person. So would our health mentor be willing to talk to the liaison? So that was our contingency plan, that they would talk to their health mentor. So the teams that were able to, who hadn't been able to do the home visit, or hadn't been able to really have a good discussion with their health mentor, they had to develop their SMART goal, their health goal, which they typically present in Module 2. They had to use the information that they had gotten from their interactions with their health mentor based on their encounter in the first semester. So the other piece to Module 2 is looking at the environment and how that influences someone's health. So typically when the students go and do the home visit, part of it, their preparation in doing that is when they go to that person's community, their neighborhood, to do a windshield survey. We want them to gather information about the resources, what they can access in their neighborhood. So in this case, we advised the students who hadn't done that, that they would use Google Street Maps view and perform their windshield survey in that manner. So just to make it clear about the student, about our training that we did. So a week before, on April 6th, we had a Collaborate session in Canvas, that's our current platform that we're using, to have the faculty facilitators, just so they would feel comfortable in terms of how to share the presentations, just feeling comfortable and just even knowing how to use this purple button down here to share presentations, take roll. So how we were conducting roll to make sure that the student teams, everyone was actually present. We just had the students type their name in the chat box. And also then just how to be able to facilitate the group meeting by using the chat box, if students had questions, and just making sure that they felt pretty comfortable in doing all that. We had discussion about student access because that came up, like, so do you want students to be the ones to advance the slides, or should the faculty be the ones to advance the slides? So we decided that we would give the students the presenter, that they had that role. They had the presenter role so that they were advancing their own slides. And that seemed to be the group among those that were facilitating. That was the consensus. So this was all information we discussed in this 45-minute training, 1-hour training. We recorded the presentation and we sent it to all facilitators so they could review the information. And again, we just really wanted to make people, I think the biggest concern was moving between presentations, that they felt comfortable with that. And then we wanted to just give you a brief overview about the presentations, just our simple format. So like I mentioned earlier, it was 5 slides. It's very precise rubric here. There's yes, no features, 6 yes or no requirements that we have for each student team. So we made sure that we discussed this also at our facilitator meeting. Is it easier for you to print them up ahead of time, or do you just want to have sort of one master one and you make a few notes about each team? So whatever the facilitator felt comfortable with. But just to make sure that we had some new facilitators, make sure that people were comfortable with knowing what was on the rubric, and to ensure that each team did in fact suffice each of the requirements. And like we mentioned, that typically our teams, so we had enough facilitators that we were able to keep it to 5 groups, 5 student teams in each room. So that's what we did to prepare. And now I will have Nathra talk to you about the results and what happened.
Thanks, Anne. So we'll go into some of the feedback and lessons learned. This is more preliminary feedback. So what happened on the day? On April 13th, we ran 14 rooms in Blackboard Collaborate twice. So that meant 14 facilitators and 5 student teams per room. All teams were able to present. Every team was evaluated and given a grade. We did happen to have a bad rainstorm just at the time that our 2-hour session, 2 1-hour sessions were taking place. And so there were some connectivity issues for both facilitators and students, some people dropping off and coming back on. However, what that provided was a great opportunity for our students to demonstrate teamwork. And students would quickly notice that there was an issue with connectivity with one of their team members, microphone wasn't working, or such thing, and they would come in and present the slide for their team members. And so that was a really nice, I think, proxy for some of the team function. So we don't have the final statistics on how many of our 44 teams did an online Zoom meeting versus a phone call versus the hypothetical situation. But we do know our health mentors are a diverse group from different socioeconomic strata. And so we expect there to be a fair amount of diversity in the way the teams were able to complete the home visit. Next slide. We did gather some preliminary data. This is about 115 responses, so a 17% response rate for evaluation of the session. And so you can see that most of our students agreed or strongly agreed that they were able to understand how differences in individuals' environment can affect an individual's health and well-being. This goal is achieved primarily through listening to the different presentations. So for at least for this cohort of people who answered the survey, the connectivity issues did not seem to cause a problem where they were not able to hear stories of the different health mentors and what their environments are like, exchange ideas and strategies to support team effectiveness, recognize the perspectives of different members of the interprofessional team, and practice teamwork skills. So all of those pieces that we want them to achieve during the interprofessional small group session, most of them strongly agreed that the session was successful. Next slide. Some representative comments about the online experience particularly. Our students were very resilient. They said things like, this can all be accomplished virtually. We have to work together to find ways to adapt to the circumstances. Even though they had some technological difficulties, they found the online presentations beneficial for their presentations. They did enjoy hearing those contrasts. They gave us some leeway. They felt that everything ran as smoothly as possible, especially with the transition to online. And then that flexibility and teamwork are essential. This time, doing this online at this moment, we do recognize that we had the benefit of having our teams have met in person in the fall, having met in person for the orientation for Module 2, and having met their health mentor in the fall as well. So this turning on a dime is different than what we might have to do going forward. Next slide. Our facilitators did have some feedback about the logistics. They did feel like we needed fewer groups. We were hoping that because the slides were preloaded in Blackboard Collaborate, and we could switch between slides very easily, and people didn't have to shuffle up to the beginning of the room or the front of the room and go back to their seats, that we would actually be better on timing. But I think there was still this hunger for having, 4 teams and to have that space for discussions. The students, we did have a conundrum of attendance. We did find that some faculty facilitators said that students would leave. There were some students who would leave after their presentations, and that's not something we had anticipated, because when you're in a small group room physically, you can't actually leave. There was also the issue of difficulty promoting conversation in the online settings. I think there was a lot of give and take immediately after a presentation with the team that was presenting, but some of that crosstalk that we get when we're in person was a little harder to facilitate. And so I think some of our facilitators who had more facility with the chat box found that was a way to engage a little bit more. So how do we promote that going forward? A lot of our students, we didn't necessarily prep the students nearly as much as we prepped the faculty, I think. And so a lot of times they were presenting with use of the, or they were presenting just audio only. And there is definitely a better sense of camaraderie when you use the video. So to have asked our students to be video ready for their presentations may have been a better process. And then there was some issue with some faculty members feeling that they should have controlled the slides versus the students controlling the slides. I know for my room particularly, the students controlled the slides and it was completely fine. And so I wonder if that's also a proxy for team functioning, if they're not knowing what slide goes next, or how to ensure that the slides are controlled. There is that lack of nonverbal cues, especially when you don't have the video going, that is useful. So, and again, how do we, in this online format, continue to keep students engaged and maintain accountability? So those were some of the comments I think that our facilitators felt. Now, when we think about this in total, when we think about where we move forward, especially when we think about the fall, we do have this vulnerable population where we may not be so comfortable having them come on campus. There get to be a few things that this experience makes us think about. Is one, how do we have effective online faculty facilitation of the student teams? How do we continue to engage our community partners, maybe in a virtual setting? And then how do we engage in team building when maybe some of it will have to take place online? And those will be different conundrums when we start the program fresh in the fall. So I'm going to turn it over to Alina Umland to introduce the next section.
We're just going to swap slides real quickly.
Perfect. Thank you.
Can you see the new slide?
I can, thank you. So one of the things that I guess all of us have probably learned since March is the importance to be agile and flexible. So we had thought about using breakout rooms for this, but we're going to take a little bit of a different approach. And based on some of Nathra's concluding comments and things to think about, we had developed 3 questions to throw out to the group to think about moving forward, because I suspect moving forward in the fall, we are all going to change the way we're doing things now. What are some things we need to consider to try to provide, in my mind, in the description with the faculty, the center, the best experiences that we can for our students, achieving the outcomes that have been intended. I don't think we're changing the outcomes, but just changing the way we might do things to achieve those outcomes. So with that, we're going to give you a series of 3 questions. And when each question is presented, hoping that you'll use the chat box feature to provide your thoughts and your input so that it's captured on the webinar. And then when it's archived, other folks will be able to see that as well. So this is our group effort at wherever we all are coming from, getting some ideas to take home and think about as we begin planning for fall. So with that, the next slide, Sean. So the first question, and again, asking you to share your thoughts in the chat box, relative to faculty facilitation online. And Nathra spoke a little bit about, we were trying to bring the faculty up to speed as quickly as possible so they were comfortable with the platform that we were using. But thinking about you all and where you are at your home institutions and the experiences that you've had relative to this, willing to share what are your best practices for executing successful online discussion. I think one of the things that Nathra referred to, and I know we're struggling with across the board in the classroom with online, is that that students have logged in, but really making sure that they stay engaged for the assignment or the activity or whatever it is that we're doing. So hoping that you all would be willing to share, just kind of throw it out there. It's like a brainstorming session. What are your best practices for executing successful online discussion with groups of students? We can also take it the other way if you've had struggles and what you've learned from those struggles relative to successful online discussion. So there's a response. Depends on the group size, agreed. Allowing Zoom backgrounds so they don't have to show their houses. That's an interesting thought, and I hadn't really thought about that. The person who posted that is the thought that students aren't willing to share because they don't want people to see the background. I guess I hadn't really thought about that before. Encourage students to turn on the video, use the chat feature. Yes, we have found the students seem to be very comfortable with the chat feature. The video piece is a little more challenging. One of the comments, giving students a dedicated role in the discussion may help to keep them engaged. Great point. Call on them to speak. Yes. Good one, the old-fashioned way. Good point about the background in the Zoom meetings relative to socioeconomic disparities amongst our students and allowing them to choose a background. That's a really good thought that I had not thought about, but certainly a really good one. Give faculty facilitators the ability to allow students to enter the session, and if they go off, they have to petition to enter once again. Is there the administrative, I don't know this. So there is an administrator function that once a student leaves a session, they have to ask to enter again. I didn't know that. That might be something to keep in mind. Students rename their screens so to be easily identified. Okay. I really like the idea of the Zoom backgrounds and the socioeconomic disparities. Starting with an emotional check-in, as many are struggling. I like that. I think we're all finding that with our students and perhaps even with ourselves sometimes. Yes, you can block so the administrator allows them back in, and you'd have to readmit them. Good ideas. Other thoughts on executing successful online discussions? So we have issues of group size, Zoom backgrounds, asking to re-enter, giving students dedicated roles, renaming screens so they can be easily identified, setting expectations from the beginning. Key. Other thoughts? You could assign each group the role to ask questions and solicit peer answers. Then each group knows that they will both facilitate and need to answer. Oh, that's a good idea too. Thinking about even how we did it with our, whatever, 5 to 6 teams within a room that, giving them responsibility for asking questions and asking questions of the peers. That's a really good idea. And then forces them to stay engaged throughout the time in order to be able to do that. Great. Any other thoughts? Okay. Using the whiteboard function to draft ideas together, great. Need adequate warm-up or icebreaker time for team building and comfort, yes. I know, one of the things, where I said this fell into Module 2, so the students had worked on Module 1 together. They had their orientation Module 1 in the small group, and they did, know each other coming into Module 2, but I think just the performing and executing Module 2 online was very different for them. So yes, I think the warm-up and the icebreaker from just that online transition piece would be very important. Make it a competition with some Easter egg clue to keep them interested in staying that's relevant to the discussion. Good ideas, really good ideas. Let's hold on to some of those ideas. So that has to do with kind of faculty facilitating and some ideas to keep the students engaged. And I'm going to hand it over to Nathra who's going to facilitate the next question that we have to pose for you all to think about?
All right, so just building off of that discussion, it sounds like we were starting to get into team building. So I want you to share those thoughts in the chat box on the following question. Team building online, how can team building be achieved virtually? We have some unique challenges in our program because our students don't actually meet in person all that often, and so they do some of their team building on their own time anyway, but without those in-person times, how do we achieve that team building? So I'd love to get your thoughts on how we can do that going forward. And maybe it's that we have to have more times that they meet. And I think there's maybe two parts to this. It's when we think about teams that then function in the outside world and work with the health mentor, and then also that comfort level in the room team building. So a balance of Zoom and non-Zoom connections. So phone calls work too. So encouraging them to talk to each other outside of a Zoom call that we set up, and encourage them to spend time on their own. Using video conferencing is key. Doing some check-ins so that they have a few minutes to connect. I think that the check-ins I think are really important. One of the things that we're trying to explore is breakout room functionality, because we have so many teams, and then we don't have enough facilitators for them to each have their own room where they can talk. Again, the Zoom background showing personal interests, like a hometown image, it's a good personal icebreaker. Okay, so back to allowing them to show their personality in a way that that curates it for them, so that they're not forced to show something they don't want to show and are showing their best self through that Zoom background. Recruiting former students to be additional facilitators in breakout rooms. Yeah, that's definitely a possibility. We do have year 2 students that could help with year 1. When we get to year 3, folks are often in the clinical setting, so it's a little bit harder. But we can definitely have like year 2 students help with year 1. What works for busy clinicians or students with no computer access for Zoom meetings? WhatsApp or other messaging groups? Yeah, so they typically, a lot of them use GroupMe right now, which I've never used, and use that on their phone. All of our students are issued iPads from most of the schools, so most of them have some device that they can use to get online, but that implies that they have Wi-Fi at home as well. Because like typically they have that, and they would use the Wi-Fi on campus. So that's an interesting piece to ensure that they have the computer access and they have some way of talking to each other. So let's see here. It's another great comment. Some team-based learning literature, but relevant here as well. Groups must be properly formed and managed. Team assignments must promote both learning and team development. Students must receive frequent and timely feedback, and students must be accountable to the quality of their individual and group work. Yeah, no, agreed. All right. I think we have some really great suggestions here, focusing on how we can promote team building. So now I'll turn it over to Ann Mitchell for the next question.
Okay. All right, so we talked about faculty facilitating, we talked about students and team building. So now we wanted to get your ideas about community partners, because that's key in our Health Mentors program. So how can community partners be engaged beyond live in-person interactions? Like Nathan was describing, right? We have a diverse range of community partners, and not all our community partners have access to social media. So we're hoping to get some of your ideas on how we can engage our community partners. So let me check here. With some team-based, I think that was from the last time. So that's still on some of the other comments about team-based with the students. Yeah, so there's a lot of discussion on that. So I think for us moving forward, this will be one of our more challenging pieces. And with the realization too, right, that so many of our community partners, that's part of what motivates them to be in our Health Mentors program, because they really like the person-to-person interaction with the students. All right, so US mail surveys was get answers back to students, right? So tried and true. And we actually still do, we mail out information to our health mentors, and many of our health mentors, that is their preferred method. So key to think about, yes, the US Postal Service is still a very valid and needed organization. So we bought iPads to give to partners and gave them tutorials so they could have access. So we actually did think about this, but yeah, we're not sure how that would work with so many, as Elena, when she described the program, right? We have over 200 health mentor partners right now. Oh, am I not, let's make sure I'm doing the right thing here. What about the telephone, good old fashioned conference calls? So I think that is an important way that we can keep our community partners engaged. Trying to figure out with students too, like instead of just having maybe a liaison student, but like having conference calls. So that's a thought we were thinking of. Because again, so one of the issues though is when we are at our home base at Jefferson, our community partners, they recognize the Jefferson phone number. So they're more likely to pick up. So that'll be an issue that if we make an arrangement, that we're going to have to make sure that our health community partners, our health mentors, are aware of what the expected phone call number would be, so that they'll be cognizant of that. So elderly, so again, let me just flip back here a wee bit. So telephone, so telehealth platforms for possible, yes, and our university does a lot with telehealth for sure. So community partners have access to a phone, right? So, and certainly, and actually, I don't think we mentioned it explicitly, maybe that we had asked our students, even if they had made their visit with their health partner, or pardon me, their health mentor, that they, once we weren't on campus anymore, we asked teams, could they still reach out to their health mentor and just check in by phone, making our students more aware, right, of issues with social isolation. Hearing about phone change in churches that do community service programs, like after school programs, assign daily check-in calls to church members or volunteers, right? So I think daily wouldn't be feasible in our situation, but that's certainly a way to keep community partners engaged. But having maybe weekly calls, I think, would be a feasible opportunity. And especially if we set it up so that the calls were at an expected time, and then our community partners would be aware that it was the Jefferson students. The attendee or not opening chat. Oh, I see. So I should read. So the last one, think I read out loud the whole thing. I've been hearing about phone chains in churches that do community service programs, like after-school programs, assign daily check-in calls to church members or volunteers. So ask your existing mentors for their ideas. So thank you, Kim. That's a great idea. That's really great. So what's feasible for the health mentor, and what do they feel comfortable with? So that's wonderful, because we have strong relationships with our health mentors, and many of our health mentors go above and beyond to give us some ideas on their experience. We have health mentors that, this is our 13th cohort, and we have health mentors who have been involved in our program for close to the entire time. So they have a lot of experience for what's worked in the different iterations of our program. All right, let me just make sure I captured people's thoughts. So a lot really did have to do with, and I apologize, I should have read out loud the whole comments, but it seems like most of them here, I mean, this is so true about having access to a phone. Elderly may still love to connect by a phone. It fits with them liking to connect. So it seems like the telephone and conference calls and the US mail are ways that we could think about it. Again, higher end would be to give iPads to partners and give them tutorials. We actually did have a discussion about that this week, so we've got some thought on that, but it might depend too on how engaged our partners are. You know, are they someone who's are going to be involved in our program for a while? So iPads can cause their own problems with internet connectivity and Comcast accounts. Okay, so we're based in Philadelphia, home of Comcast, but really important. So thank you, because the key piece I should have mentioned here was, this was suggested, and the thought was like, okay, but if we give people iPads, do they have internet connectivity? Or are we going to have to tell them to go in a parking lot somewhere where they might be able to pick up on connectivity? So the iPads, there's a whole host of things that also have to be in play, but most importantly is, do they have internet connectivity? All right. Any other thoughts here? So thank you. These were wonderful. All right, so to all the panelists. All right, so I think maybe should we go to our question, we'll report out, or we'll go to some questions here. So I think I'll turn it back to Elena to kind of figure out the report out, and then we'll go to some questions, because we've had.
Well, I guess I'd like to say the report out, I think we sort of did it as we went along, because we had all of the comments come up in the chat boxes. I wrote down, you know, a few notes. You know, I think a lot of the comments that came in are things that we've been thinking about and moving forward. You know, what we accomplished this spring, you know, it certainly wasn't perfect, but I think very proud of what we were able to do quickly, but a lot of lessons learned, and, you know, some of the things that came up about faculty facilitation and, you know, having faculty be trained to keep the students more engaged, I think is really a goal for us moving forward in the fall semester now. And then the team building online and some of the things that were shared when Nathra had that question, I think were very key. And then of course the community partners and what do they like. One of the things in our discussions recently was, you know, the telehealth piece is nice because it's good training for our students, but the other thing that, you know, perhaps, you know, and this goes back to some of the comments about socioeconomic status and diversity, in that telehealth uses data. And, you know, when you're asking a patient to use their data, you know, that costs them money. You know, so trying to be very cognizant of, you know, with our health mentors, for example, or community partners, they're volunteering their time, and we don't want to tax them with anything additional on top of that. But I think a lot of, you know, what was brought up is very, very helpful. So that was sort of the report out. We did get, early on, there was a question about, in relation to the actual virtual home visit, what do the student teams use to virtually meet with their health mentor? The question says, our students have not met their older adult patients participants yet. If they were to meet with them for the first time, what worked best for your teams to conduct the visit? We did have a couple of teams who used Zoom, and we also had a couple of teams, was it FaceTime, I believe? Some of the teams used FaceTime. And then I believe a number of the teams had to, unfortunately, as we were, trying to be as flexible as we could, there were some phone calls. So there were some old-fashioned phone calls, and then reliance on some of the information that the students gathered in Module 1 in order to complete Module 2. But certainly a couple of the teams used Zoom, and several of the teams used FaceTime. And then I think some of the things that you all brought up moving forward, the phone call piece, is certainly something to think about, especially for our elderly patients. One of the suggestions that came up that one of you all provided was, providing the mentors with iPads, and someone had brought that up on our campus too. And, my only hesitation there is it is only as good as the comfort that the person using it has. So there certainly is that. The other question had to do with the evaluation. So we presented our response rate, which was lower this semester than in the past. The surveys that we sent at the end of Module 2, as Nathra mentioned, had a 17% response rate. It's typically higher than that. Usually we have at least well into the 20s, if not more. And some of the disciplines in the past have had upwards of 100% response rates within the individual disciplines. But I do, and I think probably a lot of you can certainly empathize with this, with the moving to online, the emails, and I'll use the word bombarding of students with information online, by email, by announcements, has been huge. So there was not a huge push to keep at the students as far as completing the survey. So, 17% for this particular semester, okay. But to answer the question of the 93% agreeing or strongly agreeing with meeting the outcomes, typically our strongly agree in those 4 areas is anywhere from the high 80s to low 90s. So it was actually comparable or slightly higher because we were in the low 90s for all of them this semester. So, as far as trying to measure the success of this very quick change, delivering it differently, I would say it was as successful as it could have been, but I think we have lots of opportunities to make Module 3 perhaps more successful based on some of the things that we've learned. And let me see if there's another question. There we go. That was a response. Okay. Other questions, or Barbara, or anybody?
Yes, this is Barbara, and first of all, thank you for the presentation. I'm actually excited about the amount of comments and chatter that you were able to get on this topic. It was quite impressive. In thinking through, and we're having these conversations, we only have 2 minutes. We did the Kapow, and we did what we could. What's going to work in the future, and how do you reflect upon it? And I have to say, you brought up something that I really hadn't considered yet, is that the data plans, the people that you're engaging, this is a cost to them. How do we start to weigh all this and really have to think very differently in the future? Do you have any 1-minute wonders as we think about this?
Oh my goodness. That was actually a comment yesterday as we were talking through this presentation. I can't take credit for that. That was Nathra who brought that up. And I was like, wow, that's really something we need to think about, because, we rely on our community partners. They are volunteering themselves, so I really don't want to ask anything further. Whether we look at other things that don't required data. And I guess that's where, even as I'm listening to the whole phone call and teleconference type of thing, the university, I think we could handle and cover providing bridge lines for conference calls if we needed to. It would be a lot cheaper than providing the mentors with an iPad and, listening to the chatter in the chat box, thinking that might even be a preferred method for the mentors. So, Nathra, I'll let you comment.
Yeah, no, I think that, I think it's a huge concern, and it's something where, and for me, I didn't think about it until I saw one of my patients with a smartphone. I was like, oh, you can do a telehealth visit with me. And they said, oh, no, but I can't afford the data plan.
Yeah.
I was like, oh,
Yeah.
wow.
Yeah. Yeah.
And so I think telephone may be one of our best options, but then it doesn't give that richness of being able to see the home. And so, it's always that weighing of like, can we do what we can with what's available? And for our patients who have Wi-Fi and can do FaceTime and can do something like Zoom and show our students their home, we do that. And then for our students who our mentors who are willing to talk on the phone and to give verbal descriptions of what they're doing. For our mentors who happen to be visually impaired, they may feel more comfortable with that too. So like we have multiple pieces that we need to think about with this.
Okay, well, I'm looking at the time, and we've reached the bottom of the hour, which is our stopping point. And and I want to acknowledge Karen Hansen saying that actually the elderly prefer talking on the phone. So maybe, trying to understand what is the preferred communication. So I want to thank the Jefferson team. It was a very engaging hour. And I we do not have another webinar planned. People are going into their finals and are going to be even busier in the next several weeks. So I really want to encourage you to watch for information about the Nexus Summit and consider joining the American Interprofessional Health Collaborative, where we have these kinds of conversations. So thank you very much to the team. Thank you for all who have joined. Really look forward to the next one that we plan. Thank you.
Thank you.
Thank you.
Thanks.